So I think when you take a look at the future of healthcare, you can subdivide into different segments. You can take a look at it as the practice of medicine, which I think unfortunately will become more and more corporate just because of the way that the system is actually set up. Ultimately, most physicians will be employed by a large healthcare system. So on one hand, it's good, but on the other hand, it has a lot of shortcomings. Why? Because when you remove the autonomy from the physician and you have to follow corporate guidelines, this is how you do things. A lot of the genius of medicine actually is left because you start to become much more cookie cutter in terms of how you do things. And who suffers in that is going to be the patient. Who suffers are the families of patients, and who suffers is really us as a society. So it's very important for physicians to be able to take their fund of knowledge, be able to take the science that they've been exposed to and they've learned about, marry that, and also try new things to figure out how they can improve upon what the current standards are. Otherwise, the progress becomes halted very quickly. So from a practice of medicine, that's one of the things that I see. However, where I get a lot of excitement is really through technology and being able to focus on more of that unveiling in terms of how the body itself works. So I find proteomics, genetics to be incredible. And what do I mean by that? What we're realizing is that we would actually approach patients as a number. Hey, we did a study on 4,000 people. Of these 4,000 people, the majority of them responded in this manner. That's good for a good number of those patients. But on both sides, you're going to have exceptions. So what we've asked patients to do is to follow the norm, even though the norm is going to be right in the middle. And therefore, everything off to the side will actually be slightly different. And as you get farther and farther away from the norm, our approaches and our treatments may actually not be suitable for you. So I believe the future of healthcare ultimately needs to become personalized care. What is your genetic makeup? How are your genes being expressed? What are the proteins in your body? What's your lifestyle? What's your chemistry look like? And then based on your health status, then we should be able to come up with something that's specific to you. So we should be able to really create programs that are personalized based on each person's needs and metabolic profiles. And based on what we're seeing now, which is we're able to identify people's genetic makeup, be able to take a look at expressed proteins, I think that the opportunity is there now to be able to do that. The only other thing I would add is that as we provide solutions to patients, it becomes very important for us to be able to hone that, the Six Sigma approach, which is, hey, we're getting some response, how can we refine that to get better and better and better and better? And that's going to need an interaction from the patient as well as the practitioner, which is the more times I can say, listen, I'm giving you this, tell me about your response, let's modify it a little bit more and continue that dialogue, and that feedback allows us as practitioners to provide you better, and more personalized care.